Thank you. Welcome, everyone. This is a delight. First of all, what will happen to Ray? That is a question that many families of people with intellectual and developmental disabilities ask. They worry about the future. As one parent said to me, "I wish my child dies 4 minutes before I do," and I did not understand why would a family say something like that. And then I saw 2 articles in newspapers, one in the New York Times that I was interviewed about, actually. In both of these cases, older family caregivers killed their son or daughter that had disabilities. And it was very hard to understand why. My own father said something like that about my sister when she was in very dire straits. Well, for years, we've been working since the 1990s on interventions that bridge aging and intellectual disabilities to help people with disabilities as they age and the family caregivers. Very recently, we just got funded as a Family Support Research and Training Center to bridge aging and disability. And as part of that center, which is exciting to us, is we are working on health promotion projects for both the family and the person with disability. Also, we're working on how do families thrive? The opposite of what we just saw. And a project that I've been very engaged in for many years on future planning, which I will tell you a little more about later. Those are just some examples. I'm trying to emphasize the intervention work. In the early 90s, we started something called person-centered planning for later life. And we worked with people who had done retirement curriculums through the Aging Network. And out of that, we very much emphasized self-determination. And this is something that the disability field has contributed to gerontology, by the way, who is just discovering that people with Alzheimer's maybe could make some decisions of their own, especially in the early stages. And out of that, we developed a health promotion curriculum called Health Matters that I'll tell you some more about as it's expanded across the world. And the second one is called The Future is Now. And both of these are still being tested and still being disseminated in different ways. They both have a virtual version that we're testing, not only virtual train the trainers, but also virtual in its implementation. And the reason is we believe very strongly when you have a curriculum, you don't want it just dead after you do it. You want it to live. You want it to make a difference. So what are some of these center outcomes? We've had lots of wonderful outcomes over the years in improving the health of people with IDD, who, by the way, often age earlier than the general population. We've also helped families in terms of their own caregiving appraisals, and many of them have a lot of caregiving satisfaction as well. It's not only the negative stories. We've also found that we make changes, as they do health promotion, changes in the staff that work with people with developmental disabilities, as they also think about their own health and well-being. Widespread outreach is something that we really value, and the Health Matters curriculum is one of the really only evidence-based curriculums for health promotion for this population. It's been spread from around the world and in 37 states, 147 organizations, and over 10,000 participants using this train-the-trainer approach, and they're still testing it. And the Future is Now that we're working on is also now, has been done in several countries and many states. We just finished some trials in California where there were over 1,000 participants, many of them Spanish-speaking. So we're very excited about that. And to continue, we're working now with US Aging to disseminate and to recruit for our totally virtual versions of The Future is Now. And we've had a national impact. And I'll first talk, we have the National Task Group on Intellectual Disabilities and Dementia Practices, which is an NGO now and does training all over, and it's part of the NAPA a national Alzheimer program plan is also, they've been involved with that. And the one that is close to my heart is the National Sibling Leadership Network that I have co-founded. And you can see what has sparked my interest is my sister, which you see in this picture here, as she was the one my dad was so worried about, and she is now in good hands, living in a good place where she's getting the supports that she needs. Thank you.